itching. I mean, the itching can be outrageous. Also, burning. We're talking about symptoms of yeast infections, vaginal yeast infections, and itching and burning are some of the common symptoms that happen, especially around the vulva, which is sort of the external genitalia down there, okay? Itching and burning, huge, but also irritation in general can happen. You can get pain with sex. There are other symptoms. I'm going to tell you what they are, so stick with me. Also, I'm going to talk about the discharge, which tends to be very particular if someone has discharge with vaginal yeast infections. Guys, I'm Dr. Jen Caudle. It's good to see you. I'm a practicing family physician, on-air health expert, and video creator. Let's continue. By the way, we are talking about vaginal yeast infections. I'm going to tell you not only the symptoms, which we've started, but also the causes, why they even happen, how to get diagnosed, and what the treatments are. Okay, so let's go back. We'll get back to the symptoms in just a second. So you're probably saying, why do these yeast infections even happen? What's the deal with them? First of all, you should know that we have sort of yeast that sort of lives in our gut, lives in the vaginal area, just hangs out, does its thing, doesn't bother anyone. However, when the environment or our situation, our health situation changes, sometimes it allows the overgrowth of that yeast, and that can cause a vaginal yeast infection. Now, I know you're probably saying, well, what could cause the environment to change? What could cause that overgrowth of yeast? Well, there's a few things. Certain medications, okay? Antibiotics are notorious for some women for causing vaginal yeast infections. In fact, I have some patients that whenever I give them an antibiotic for something, they know they're going to get a yeast infection because it always happens with them, and we have to sort of get them ready in advance, give them medications to have on hand in case it happens. So certain medications can sort of change this environment that the yeast are in, causing them to overgrow, contributing to this vaginal yeast infection. But that's not the only thing. There are other conditions. Pregnancy. Yeah, the state of pregnancy can create an environment where women may be more prone to having vaginal yeast infections, okay? But that's not it, all right? Diabetes, okay? Especially uncontrolled diabetes. Yeah, that can do it. Also, people who have a weakened immune system. And remember, one's immune system can be weak for a number of different reasons, whether it's because of certain medical conditions that someone has or certain medications that they're on. And also, I think this is really interesting, contraceptives can potentially increase the risk of someone to get vaginal yeast infections, okay? But even though these are risk factors, please know that most women don't have an underlying health condition leading to the yeast infection, okay? I haven't said this yet during this video, but you can see that this is an important topic, one to talk with your doctor about, especially if you get yeast infections, they're recurrent, or even if it's your first one, you should be talking to your doctor. Okay, the other thing is, okay, you probably are wondering, well, who gets yeast infections? In terms of vaginal yeast infections, is it all women? Okay, and that's a great question because vaginal yeast infections are most common in sexually active women. However, vaginal candidiasis or vaginal yeast infections are not considered a sexually transmitted disease. And vaginal yeast infections can happen in women who have never had sex. So please remember that and keep that in mind. And along those lines, vaginal yeast infections are most common in menstruating women. They are less common in postmenopausal women, and they are rare in women who have not gotten their period yet. Okay, so just sort of keep that in mind. This is not an STD, and women, whether they are sexually active or not, can get vaginal yeast infections, but it's most commonly seen in sexually active women. All right, next. All right, you're probably saying, well, so symptoms. Let's go back to that, okay? Super important because I talked about the itching and burning that can happen around the vulva, which is the external genitalia. Can be really, really intense, can be really, really bad. You can get irritation, as I mentioned, but you can also kind of get swelling of the vulva. That's the external genitalia. Can actually get swollen, kind of get pink, irritated, inflamed. It can get sore. Pain with sex can happen, but not just that. Let's talk about the discharge. Now, first of all, let me say that you don't actually have to have an unusual or abnormal discharge with vaginal yeast infections. Most women I see, most of my patients I see with them do have an abnormal discharge. I'm going to tell you what that is, but you don't have to, okay? So don't think, oh, well, I have some itching and burning. It feels weird down there, but I don't have a discharge, so it must not be a yeast infection. Don't think that way because not everyone gets an abnormal discharge, okay? Now, the thing about it is women, like patients of mine who have gotten yeast infections with discharge, it tends to be almost like cottage cheese-like. That's a description that we often use when describing it. Almost curd-like. Yeah, like cheese curd, something like that. It can be lumpy. Often it's white and lumpy, often kind of clumpy. It can stick to, the vaginal walls and things like that. And many women who have vaginal discharge with their vaginal yeast infections, they notice it as being pretty distinct, okay? This is something really important to keep in mind. Again, saying it again, not everybody gets discharge, but this sort of curd-like, cottage cheese-like discharge tends to be pretty popular in women who do get discharge with vaginal yeast infections. Now, I should say that this discharge doesn't usually have an odor, so keep that in mind. We don't usually see an odor with this. This isn't contrary to other vaginal conditions or vaginal discharges where there may be an odor, okay? And the discharge tends to be white, like a whitish discharge, pretty clearly white, all right? Now, moving on. Now you're saying, okay, well, what do I do if I have this? Well, first thing I want you to do is to go to your doctor. Why? Because even though I've talked through some of the most common symptoms, most of the most common symptoms, the truth of the matter is we're not always great. We, as like people of the world, we're not always great at diagnosing ourselves and accurately spotting yeast infections versus other things. Remember, there are plenty other things that, say, itching and burning of your vulva could be. Painful sex could be other things. Itching and burning can be other things. Even an unusual discharge can be other things. So you don't want to just sort of rest on your laurels and sort of rest on your hunch. You want to go to your doctor and get a proper diagnosis. They're likely going to stick a little swab in, okay, just and test it and see what comes out, okay, and they will make sure that it's actually a yeast infection versus something else. Because remember, if you don't have a proper diagnosis, very likely you may not get proper treatment, and that is the most important thing. So if you have this, you want to see your doctor, all right? Now, treatment, let's talk about this. Generally, treatment is pretty easy peasy. That's the good thing about this, okay? It's either sort of vaginal medications that are used vaginally or oral by mouth medications, okay? And, honestly, there are over-the-counter medications that are vaginal vaginal over-the-counter medications for vaginal yeast infections that are out there as well. But again, I want you to get a proper diagnosis. Make sure you're treating the right thing. But yeah, it's pretty easy to treat. Usually people, like honestly, I've had patients who they start taking the medication, especially the oral pill, in my experience, within like hours, they're starting to feel better. Okay, but every person is going to be different, obviously. Again, you want to check with your doctor, make sure you know what's going on. It's also just a reminder that let's say you have diabetes. It's another reason to make sure your diabetes is controlled. Make sure you know what's going on with your body. Now, once again, there are many potential causes of vaginal yeast infections that you cannot control. We talked about those. Please know that most women don't have an underlying health condition leading to the yeast infection, okay? But, things like diabetes, etc., keeping that in control will help, as well as potentially some other things. So, guys, I hope this is helpful. Let me know in the comments. Share this video with anyone you think it might be helpful for. And I do these videos hoping that both men and women will watch, because our health affects really all of us, because we have people in our family that we love of different genders, right? So please like, follow, do all that kind of stuff. Share the video, comment, let me know what your experience has been. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos. Make sure you subscribe to my channel on YouTube. Got lots of videos and all sorts of stuff, not just sort of sexual health things, but you name it, blood pressure, cholesterol, asthma, all the good stuff. On Facebook, please like and follow my page. Also, go to my website, drjencaudle.com, so you can sign up for my free health newsletter. Guys, I'm Dr. Jen. Love y'all. See you soon.